Hello, and welcome to the Healthy and Helpful podcast. I'm your host, Dr. Bolande Liman, and today we're diving into a topic that touches every one of us: mental health. Whether it's personal struggles, supporting loved ones, or simply navigating the challenges of daily life, mental health is a vital part of our overall well-being. Let's start by looking at the current landscape. According to the National Institute of Mental Health, nearly 1 in 5 adults in the United States, that's approximately 57.8 million people, live with a mental health condition. Among youth, the situation is just as urgent. The CDC reports that more than 40% of high school students feel persistently sad or hopeless, and suicide remains the second leading cause of death for those aged 10 to 14 years and 20 to 34 years. Despite the prevalence of mental health challenges, nearly half of people with mental illness don't receive the treatment they need. This is often due to stigma, access barriers, or lack of resources. Mental health is not just an individual issue, it's a societal one. It affects our families, workplaces, and communities, with untreated mental health conditions costing the United States economy over $200 billion annually. In this episode, we'll explore access to mental health services, the importance of early intervention, and resources. This is a space where it's okay to not be okay, and together we'll discover ways to heal, grow, and thrive. Let's get started. Without further ado, I'm excited to begin our conversation with Dr. Herford.
It's a pleasure to be with you. Thank you.
Dr. Herford, please tell us briefly about your experience and current role in the mental health field.
I'd be happy to. I'm a psychiatrist by training, have been so for about 20 years. And most of my work has really been focused on the public behavioral health system. So folks that are covered by medical assistance, government-funded programs. I've worked in diverse clinical settings like community mental health centers in Center City, Philadelphia, and even on the Native American reservations in southwestern United States. More recently, I have had the privilege of managing a nonprofit insurance company that helps people on Medicaid get mental health and substance use disorder treatment across Pennsylvania. That's a part of the University of Pittsburgh Medical Center. Our organization is called Community Care Behavioral Health, and we help support about 1.5 million Pennsylvanians getting access to high quality behavioral health care by partnering with 43 of Pennsylvania's 67 counties. So it's been quite a journey, but a real privilege and an honor.
It's a pleasure to have you join us and shed some light from an insurance standpoint. When one has health insurance, it's often challenging to find a comprehensive list of in-network behavioral health providers. Can you please explain what in-network versus out-of-network means?
Sure, and I can really appreciate it, especially when people are trying to navigate getting healthcare, whether it's behavioral healthcare or physical healthcare. Just that there's a lot of jargon and a lot of unfamiliar terms out there. So I appreciate you taking the time to let us define some of these terms. Insurance companies create networks of providers to help meet all of the health needs of their members. And they do that for a couple of reasons. Most importantly, they want to make sure that there are providers that meet the quality standards and provide appropriate clinical services so that when you or a loved one needs to get behavioral health care or go get a joint replaced, you feel confident that you're going to a provider that's been reviewed and vetted by your insurance company. There's also some financial benefits, and providers that join a network with an insurance company negotiate a rate for the charges that they bill for their services. And you, as a covered member of an insurance company or insurance plan, can benefit from those lower charges by going to see a provider that's in your insurance company's network. And that's when we refer to providers as being in network. But there may be instances in which, for a variety of reasons, you need to access care from a provider that's not in your insurance company's network. And when you do that, it's called going out of network or seeing an out of network provider. And all that really means is that the insurance company hasn't gone through the same degree of contracting and negotiation with a provider. And sometimes that can mean that you may have to pay more out of pocket for that treatment or services because your insurance company hasn't had that opportunity to negotiate a contract, bring rates down, and have the provider join their network.
We both just use the term provider. Is a provider an individual, a company, both?
Provider is a generic term that we use to encompass really the whole continuum of people, organizations, and facilities that provide healthcare. So in this case, a provider could mean a psychiatrist that you see for medication or therapy. It could also refer to a hospital facility where you go and have inpatient treatment for a severe mental illness or substance use disorder, like alcohol use disorder. So we use the term pretty broadly, and because we don't want to keep saying a therapist, a doctor, a nurse practitioner, a rehab facility, a hospital. We lump those together and refer to them collectively as providers or healthcare providers.
Now that we are familiar with the terms in and out of network providers, can you please share some recommendations on how to easily find a list of one's in-network providers?
The first step I'd recommend is to understand what your particular insurance coverage looks like. And because oftentimes your insurance company or managed care organization, we use those terms interchangeably as well, have a wealth of resources to help you identify a provider that meets your unique needs. Now, most people in this country have their healthcare paid for in one of three ways. They are either get their healthcare paid through some government provided insurance program that includes Medicare, primarily for older adults, Medicaid for those that qualify because of lower income or other disabilities. That's true for people with Medicare as well. And then a second group that receive their care through their job. So this will be employer-sponsored healthcare, we sometimes call, and that's usually a part of a benefit package that an employer provides to employees. The third category is for people that don't have either of those types of insurance and oftentimes have to self-fund their healthcare. So we sometimes refer to this group as uninsured or self-pay. And in each of those cases, the good news is there are resources to help individuals, regardless of which of those coverage situations you're in, access healthcare. The first two groups are very similar in how best to go about accessing care, because whether you are covered under Medicare, again, that's that program for older adults and those with certain disabilities, Medicaid, or you're getting your healthcare through your job, you're likely to have your healthcare managed by an insurance company. So even though the funding source might change, you're working with an insurance company, and you probably got a card and get one every year that has the name of the insurance company, phone numbers to call. That's a great place to start. Whether you want to pick up the phone and call the number on the back of your card or go onto their website. And by doing that, you can get connected with a customer service representative, explain your unique situation, and ask for help identifying a healthcare provider in your area that meets your needs, and they should help you navigate through that process. If you're in that third bucket, where you may not have public or private insurance, there are a number of resources to help connect you with care. In Pennsylvania, we're fortunate that most counties have excellent county mental health offices whose one of their responsibilities is really helping people who are uninsured or self-pay get connected to low or no cost behavioral health care. That information, again, is usually searchable on the internet or but just by calling your county office. By doing that, they'll have a directory for providers that may be able to see you at a reduced cost based on your income and help facilitate an appointment.
Thank you for differentiating the three insurance categories and offering suggestions on how to identify a healthcare provider. I'd like to add to your third category, uninsured or self-pay individuals. For those who do not have health insurance, there are federally qualified health centers across every state. Federally qualified health centers, FQHCs, provide care regardless of one's ability to pay and their insurance status. For listeners without health insurance, if you Google Federally Qualified Health Center, also known as Community Health Center, you should be able to find a resource for yourself, family member, friend, or colleague.
I'm so glad that you brought up that resource, and I would just add to that list that in some rural communities, there are similar facilities known as rural health clinics, RHCs, which you can search for in the same way, that provide those services as well. And it's a wonderful resource that offers an array of physical and oftentimes behavioral health services.
Behavioral health covers a wide array of services, including counseling, psychiatric evaluations, inpatient treatment, substance use disorder programs, amongst others. This can be daunting. Do you have any recommendations on how to navigate this complex system and ways for our listeners to educate themselves on a variety of services available to them?
Yes, there are a host of ways that people can get educated about that array of services that you mentioned. You know, in Pennsylvania, we're very fortunate that we have a very well-developed continuum of care for behavioral health services. And there are ones that people may be very familiar with that we've already talked about, like counseling or individual therapy, hospital-based treatments, and rehabilitation programs for people with substance use disorder. But then there are some very novel and innovative services that folks might not be as familiar with, such as certified peer support, psychiatric rehabilitation. And these are really innovative services that can help individuals with a variety of challenges get connected to care, meet their kind of unique needs in a community. And a great way to get educated about them is either to give your insurance company a call, ask to speak to someone about what behavioral health services are available under your benefit package. But another resource would be those county mental health offices that I spoke about. They tend to be local experts in the services that might be available in your area. In other states, though, sometimes that's managed at the state level. So if you're not in Pennsylvania, you can always call to look for a state office of mental health. And then the third category of resources to really get educated about all these different services that might be and supports that might be available would be through national organizations that advocate for mental health. A couple that have active chapters in Pennsylvania include Mental Health America, MHA, as well as the National Alliance for Mental Illness, or NAMI, it's NAMI, both of whom have excellent online resources that explain the variety of services and oftentimes also offer links about how to access those services in your community. I would also add to that last bucket some national or federal resources that can be very helpful. For example, the federal government's Substance Abuse and Mental Health Services Administration, or SAMHSA. That's SAMHSA.gov, which also has a lot of resources on this topic.
Thank you for the resources you just shared with us. Mental Health America, MHA, National Alliance for Mental Illness, NAMI, and Substance Abuse and Mental Health Services Administration, SAMHSA.gov. I personally have received great education from the resources offered by SAMHSA. I'd like us to now segue into the important topic of cost. Understanding a health insurance plan and what it will cost to get the behavioral health services we need can be daunting. Can you please give us an overview on some important insurance terms we should be familiar with? For example, co-pays, deductibles, amongst others.
Sure. Here again, it's another whole library of jargon and terms that we don't really use anywhere outside of the insurance world. So great to spend some time trying to decode some of these. So the first term that might be helpful to define is copay. Copay is very simply a payment that you, as a patient or someone getting a treatment service, pay to the provider whenever you get a service. And that's a payment that you make in addition to what the insurance company will pay the provider for seeing you. So, for example, if you go to see your primary care doctor, or if you have a visit to the emergency department because you hurt your ankle, you may be asked to pay a small copay, $20, something like that. And that primary care doctor or that emergency department will also take your insurance information, and the bulk of that charge will be sent to your insurance company, who will pay it. So co-pay in this case refers to a payment that you make along with the insurance company. Another term that folks might have heard and be familiar with, sometimes they see it on what's called an explanation of benefits, or EOB letter, that they receive after they've seen a doctor or been in the hospital or had a surgery, is the term deductible. And deductibles are simply a minimum amount that you as the patient will pay or need to pay every year before your insurance starts to pick up the tab. And so that might mean that you have to pay for the first $100 or $500 or more of your healthcare in a given year before your insurance company starts to pay. And those vary widely. And in some government programs, insurances like Medicaid, those deductibles are zero. In others, they can be higher. And for individuals that are paying for insurance themselves, having a higher deductible is one way that they can lower what's called their premium. Premiums are the amount of money that you or your employer has to pay for the insurance coverage itself. It's essentially what it costs to buy insurance. So having a higher deductible usually means that your premiums, the amount that you pay every month or every year to the insurance company, are lower. And then there's one other term that sometimes comes up, and that's co-insurance. So co-insurance is your share as the patient of costs that you must continue to pay once you've reached your deductible. So let's take that example where your insurance policy says you're responsible for paying the first $100 of your healthcare every year. Co-insurance can kick in after you've paid that $100, and you may be responsible for paying 10% of all of the charges from your healthcare provider after that, and your insurance company pays the other 90%. In many cases, the co-insurance is zero, meaning that once you've hit your deductible, the insurance picks up the rest. But for some services, it may be that you have some co-insurance. All of that is usually explained in a member welcome packet or the initial enrollment paperwork that you get, and should also be available to you on your insurance company's website. And whenever you call, you could always ask if you're unclear about what these terms mean, or something that shows up on a bill, why you're being asked to pay for something, or again, what some of these different things mean.
Thank you for explaining multiple terms that are important for us to understand when seeking a health insurance plan or learning about the plan we have. Now, hypothetically, one has health insurance, has found a behavioral health provider who accepts their insurance and whom they would like to establish care with. A question I often get asked is there a limit to the number of sessions one can get? For example, there's often a limit to the number of physical therapy sessions one can get after a referral's been placed. Are there caps or limits to the number of mental health visits one can receive?
There may be some limits depending on your particular situation and the insurance coverage that you have. The good news is there has been, particularly in recent years, a broad appreciation and deeper understanding about the critically important role that mental health plays in overall health and well-being. And so what we've seen generally in the across the insurance industry is a reduction or even elimination of many of the treatment limits or caps, as you mentioned, for mental health services. If you have questions about whether there may be any limits or caps, again, encourage you to out to your insurance company or check on their website. But in general, most folks will find out that most of the routine mental health or substance use disorder care will be covered under their benefit package.
This is great news. I'm sure many people listening are delighted to hear that there are fewer limitations to these critical services. We often hear about there not being enough or there being a shortage of mental health providers. How do you determine if there are enough mental health providers in geographic areas?
Well, as an insurance company, it's one of the things that we spend a lot of time on, and it's really a continuous exercise, not something that we just do, once a year. We are continuously seeking to understand what are the needs of our members of our health plans, and do we have not just the right providers, but do we have the correct providers offering great services, high quality treatment that are accessible in the way that people want to receive them at the time, for the duration, et cetera, that they need. We do this through a variety of different techniques. Some of them are a little technical. We use something called a geo-access software. So that allows us to see where our members live and to be able to then map our providers to where our members live. That helps us understand, do we have enough providers that are geographically close to where our members live and work so that folks don't have to drive too far to get the kind of care that they need. Another way that we help understand this is through continuous member satisfaction surveys. And we spend a lot of time asking questions about, were you able to access the care that you needed in a timely enough way? We also ask questions about, were you able to find providers that not just met your healthcare needs, but also delivered it in a way that made you feel respected, that was affirming to your unique cultural backgrounds, because we know that people have important preferences about who their healthcare provider is. Healthcare is such an intimate experience. It's important that people feel that they not only get the care they need, but that it's being delivered by people that they feel comfortable seeing and working with. So those are a couple of the important ways in which we are continuously assessing whether we have a provider network meeting the needs of our members.
This is a perfect segue to my next question. From what you just shared, you're exploring innovative ways to gather data. Are you offering any innovative solutions to improve access to care utilizing that data?
We sure are. And, the COVID pandemic really kind of put us all into a time machine and shot us forward into the future. And by that, I mean, we had to rapidly implement a whole host of innovative solutions when stay-at-home orders and isolation and other practices were put into place for the good of public health. But we still had people, of course, that not only had the same health needs as they did before, but in many cases had much more significant health needs, not just related to the COVID impact directly, but also people began experiencing depression, anxiety, stress. We saw an uptick in substance misuse, drugs and alcohol, for example. The suicide rate increased during the pandemic. And we couldn't simply wait for people to return to work, for providers to reopen their doors. We had to find and uncover, develop, and scale innovative ways of meeting people where they were despite those limitations. And so what we did as a health plan was to rapidly expand our telehealth network, and in this case, our telebehavioral health network. So within less than a week, we created pathways for therapists, case managers, psychiatrists, nurses, anyone involved really in the behavioral healthcare field to be able to deliver those services telephonically and also virtually. So almost overnight, we went from a system that was operating in a very traditional kind of brick and mortar model where if you wanted to go see your therapist, you hopped a bus or drove down or got on the subway, went to a clinic, waited in a waiting room, walked in, had your appointment for 30, 40 minutes, an hour, however long it was, and then commuted back to suddenly being able to pick up the phone, or if you had a screen or smartphone or computer, to be able to have a virtual telehealth session. And it was an experiment that was really born out of the necessity of the COVID pandemic. And we used it as an opportunity to talk with our members about what was their experience like suddenly going from lots of in-person care to doing things virtually overnight. And what we found really surprised us. That was that our members, by and large, really enjoyed and the ability, the flexibility to interact with their healthcare provider in this new way. For some people, it meant the difference between having to, for example, get daycare if they were a single parent, or leaving a job where they may or may not have the kind of benefits that allow them to take paid time off. And so it actually eliminated many barriers. We have people that live in very rural communities where the ability to have that online session meant that they didn't have to drive 45 minutes or more to get to an appointment. And they found that the connection with their therapists or case managers or doctors were still very strong and very positive. We were a little bit worried about what would happen when we moved into that virtual space, whether something would be lost. But people receiving those services rated the quality and the outcome of those interactions with their providers, those appointments, as good, if not better, on average, than in person. So coming out of the pandemic, we continued to offer that kind of flexibility across our network. Now, we also know that there's a lot of new technology coming online, and there are many startup companies, many of whom you'll see advertising on television or on billboards that offer different digital services. UPMC Health Plan and Community Care also make some of these services available online and through digital apps or tools to help with things like wellness coaching. So an example of that might be to offer tips and coaching around how to get better sleep at night, since we know that plays such an important role in stress management, helping to support routine exercise and healthy eating, since we know both of those can positively improve symptoms related to depression or anxiety. So it is, I think, an incredibly exciting time to be expanding the number of tools that we have in the toolbox to help people access not just treatment, but also services, supports, and education to really empower them.
Thank you for highlighting the importance of not just treatment, but also education and support. During the COVID-19 pandemic, federally qualified health centers were finally reimbursed for telemedicine services. Prior to the pandemic, FQHCs were only reimbursed for telebehavioral health services, and so FQHCs have definitely benefited from this expansion of services as well. My last question for you today is, what do you think are the biggest challenges and opportunities in the mental health field today?
Well, there are three of them that really jump right to the top of mind. And these are things that Community Care and UPMC, we have been working on for some time, but I think they've very much been kicked into high gear. Some of that's related to the COVID pandemic itself. Some of that is related to the spotlight that I think has been shown on mental health. It's hard to say that a global pandemic has a silver lining. But what I will say is that one of the ways in which the experience of going through a global pandemic has benefited the behavioral health field is that it has opened up a national or really even a global conversation about the importance of mental health. During that kind of collective traumatic experience that we all went through, people felt more comfortable acknowledging that it was okay to not be okay, that depression, anxiety, stress, drinking too much alcohol or using drugs, for example, was something that should not be kept in silence, as it had often been for generations in the past. And what that meant, as we saw celebrities, athletes, politicians, other people in the public spotlight talking more openly and candidly about their experiences with mental health, is that we saw a concomitant rise in the demand for those services as people felt that, hey, maybe it's okay that I'm feeling this way. And not only that, but I've noticed somebody that I admire. Maybe somebody that I look up to in the public sphere who's talking openly about their experience, has gotten treatment, and is now feeling and doing better. And I think all three of those points are important because it shows that treatment's available, that it's accessible, and that it's effective. And so one of the biggest challenges we have is expanding our behavioral health system to keep pace with this growing demand. And that is one of, I think, our public health's greatest challenges and opportunities. And the healthcare system can't do it alone. We need people who want to go into this field. It's an exciting time to do that. So we need to partner with our training programs, with our academic institutions, colleges, universities, and even younger high schools, and getting people thinking about careers in in behavioral health. The second area of challenge or opportunity is really around how can we continue to better integrate behavioral health into the larger healthcare, and I would even say kind of wellness space. Now, it's important to understand how the interplay, the connection between our physical health and our behavioral health. But most people know this intuitively. You can tell when you're stressed, you can feel it in your body. And oftentimes, if you're having a physical health problem, whether you're sick or injured or dealing with chronic pain, how much it can affect and impact your mood. So that's pretty intuitively obvious to everyone. But the good news is there's great evidence to show that when you address your physical health care, your mental health gets better. When you address your mental health and well-being, your physical health can improve. I think this next challenge for us is also expanding that circle even further and realizing that there's such a critically important role in our social health. In other words, are we connected to people and have healthy social relationships, friends, family, coworkers? Because we now know through lots of really high quality research that social isolation, simply the quality of being alone and not having those meaningful connections in your life, can be far more damaging to your overall health, your mental health and your physical health, than smoking, for example. And it's one of the reasons why I'm so grateful that the Surgeon General of the United States has really championed addressing the loneliness epidemic in our country. So as we talk about integrating care in the future, I think increasingly we really want to think about not just physical health and behavioral health, but also that social health. Are you out there exercising? Do you have meaningful relationships? These things are going to be increasingly important, and how we sort of address them as a culture and as a society is going to be very important. And then the third piece is just quite simply continuing to reduce stigma. We talked about how I think we made great progress on that during and coming out of the pandemic, but we still have a long way to go. We're still, as a society, not at the place where people feel as comfortable checking in with someone when they sense that their mood might not be okay as they do when they notice something wrong physically. You know, if you had a friend that was walking down the street with a new limp, you wouldn't think twice about saying, hey, what's going on with your leg? But we're still oftentimes so hesitant about reaching out similarly and asking someone, we notice that their mood is down, or they're not showing up as regularly to work or to social events. But it is just as important for us to be um, not victims to the stigma and shame that we unfortunately still have around mental health. These should not be barriers to us checking in with ourselves and with those that we care about their mental health and well-being.
Dr. Herford, thank you so much for joining us today. We greatly appreciate your expertise and insight.
Thank you so much for having me, and thank you for sharing this time and shining the spotlight on mental health.
In this episode of the Healthy and Helpful podcast, we explored the vital topic of mental health with Dr. Herford. I extend my deep gratitude to Dr. Herford for joining me today. We highlighted national organizations that advocate for mental well-being, including Mental Health America, MHA, and the National Alliance on Mental Illness, NAMI, as well as federal resources like the Substance Abuse and Mental Health Services Administration, SAMHSA. Listeners also gained insight into essential health insurance terms, co-pays, deductibles, and co-insurance to help navigate mental health coverage. Most importantly, we discussed loneliness epidemic and the power of social health, emphasizing that a lack of strong social support can be more harmful than poor physical health and even smoking. My hope is that this episode empowers you to seek mental health support when needed, whether for yourself or a loved one. Thank you for joining this conversation. I look forward to sharing more valuable discussions in the next episode. Until then, be well.